Welcome back to Healthy Wisdom for Seniors. Before we begin, I want to ask you something important. If an infection in your body suddenly became life-threatening, would you recognize the warning signs before it was too late? Every year, hundreds of thousands of people lose their lives because the early signs of sepsis are mistaken for the flu, exhaustion, aging, or simply having a bad day. Sepsis is not just an infection. It is the body's extreme response to an infection, and once it begins attacking your organs, every minute matters. Health authorities emphasize that sepsis is a life-threatening medical emergency and that early recognition can save lives. Before we continue, please subscribe to Healthy Wisdom for Seniors and turn on notifications. Our mission is to help older adults and their families stay informed, stay independent, and stay healthy. And make sure you stay until the end of this video because the final warning sign is one that many seniors completely overlook until they end up in the emergency room. Now let's begin. Imagine a 72-year-old man named Robert. He develops what seems like a simple urinary tract infection. He feels tired, slightly achy, and decides to rest at home. The next morning, his daughter notices something unusual. Robert seems confused. He repeats the same questions and struggles to remember what day it is. By evening, he is rushed to the hospital. The diagnosis, sepsis. Doctors often say that sepsis doesn't always announce itself dramatically. Sometimes it whispers before it screams. That is why knowing these early warning signs could save your life or the life of someone you love. Warning sign number 10, feeling that something is seriously wrong. Many sepsis survivors describe an overwhelming sense that something is terribly wrong. They cannot explain it. They simply know they feel different. Some report feeling as if their body is shutting down. Others describe intense fear, weakness, or a sensation that they may not survive. This symptom may sound vague, but experienced healthcare professionals know it can be significant. Never ignore a sudden and dramatic decline in how you feel, especially if you already have an infection. Warning sign number 9, extreme pain or severe discomfort. One of the most commonly reported symptoms among sepsis patients is severe pain. Not ordinary pain. Not the discomfort of a cold or mild infection. Many survivors describe it as the worst pain of their lives. The pain may affect the entire body rather than one specific area. It can feel like deep muscle aches, crushing weakness, or unbearable discomfort. When your body launches a massive inflammatory response, tissues throughout the body can become affected. If pain suddenly becomes extreme during an infection, seek medical attention immediately. Warning sign number 8, fever, chills, or feeling extremely cold. Most people associate infection with fever, and they are correct. Fever is one of the body's natural defenses against invading germs. However, many older adults do not develop high fevers even when seriously ill. In fact, some develop the opposite problem. Their body temperature drops below normal. This is particularly dangerous because many families assume a person cannot be seriously ill without a fever. The truth is that feeling unusually cold, shivering uncontrollably, or having a low body temperature can be just as concerning as a high fever. Health experts identify both fever and abnormal temperature changes as important warning signs of sepsis. Warning sign number 7, rapid heart rate. Your heart works like a pump, delivering oxygen and nutrients throughout the body. During sepsis, blood vessels begin to behave abnormally, and circulation can become compromised. To compensate, the heart beats faster. Some people notice their heart racing while sitting still. Others experience pounding in their chest or unusual palpitations. A rapid heart rate may be your body's attempt to maintain blood flow to vital organs. If your pulse suddenly becomes much faster than normal during an infection, do not dismiss it as anxiety or stress. Warning sign number 6, fast breathing or shortness of breath. This is one of the most overlooked warning signs. Many people assume they are simply tired or out of shape. But when sepsis develops, the body often demands more oxygen. The lungs respond by increasing the breathing rate. You may find yourself breathing faster without realizing it. Family members often notice it first. They may observe that you are taking quick breaths, struggling to speak in full sentences, or becoming winded with minimal activity. Medical experts consistently identify rapid breathing as one of the most important early clues that sepsis may be developing. Warning sign number 5. Unusual fatigue and extreme weakness. We all get tired, but sepsis-related fatigue is different. Imagine feeling so exhausted that walking across the room feels like climbing a mountain. Many patients report profound weakness that arrives suddenly. Activities they performed easily the day before become difficult or impossible. This occurs because the body is redirecting enormous amounts of energy toward fighting infection while simultaneously coping with widespread inflammation. If weakness appears suddenly and seems disproportionate to the illness, pay attention. Your body may be sending an urgent warning. Now, the next warning sign is one that many families miss entirely because they often blame it on aging. Yet for seniors, it may be among the earliest clues that sepsis is developing. Warning sign number 4. Sudden confusion or changes in mental status. If there is one symptom every family member should remember, it is this one. A senior who was thinking clearly yesterday may suddenly become confused today. They may appear disoriented, forget familiar names, forget where they are, or seem unusually sleepy. In older adults, confusion is often one of the earliest signs that something serious is happening inside the body. Community discussions among healthcare professionals frequently point to altered mental status as a key warning sign that should never be ignored in older patients. The brain is extremely sensitive to reduced oxygen delivery and inflammation. When sepsis begins affecting circulation, mental changes may appear quickly. Families often assume the person is simply tired or having a bad day. That assumption can be deadly. Warning sign number 3. Changes in skin color or appearance. Your skin can reveal what is happening inside your body. During sepsis, circulation problems may reduce blood flow to the skin. As a result, the skin may become pale, gray, bluish, mottled, clammy, or unusually sweaty. Some people develop rashes or discoloration. Others notice their hands and feet becoming cold despite feeling feverish. Health authorities specifically identify clammy or sweaty skin as an important symptom that should raise concern. When circulation begins to fail, your skin may provide one of the earliest visible warnings. Warning sign number 2. Low blood pressure, dizziness, or fainting. As sepsis progresses, blood vessels may widen and leak fluid. Blood pressure can drop dangerously low. This reduces blood flow to critical organs such as the brain, heart, and kidneys. You may feel dizzy when standing. You may experience blurred vision, weakness, lightheadedness, or even fainting. Low blood pressure is often a warning that sepsis is becoming severe and immediate medical treatment is required. This is one reason doctors consider sepsis a true emergency. Every hour of delay can increase the risk of serious complications. And now we come to the warning sign that many people never connect to sepsis until it is almost too late. Warning sign number 1. Decreased urine output. Most people never think about how often they urinate. But your kidneys require healthy blood flow to function properly. During sepsis, circulation problems can reduce blood supply to the kidneys. One of the earliest signs may be a noticeable decrease in urine production. You may find yourself going to the bathroom far less often than usual. When this occurs, it can indicate that organs are beginning to suffer from inadequate blood flow. Reduced urine output is considered a serious warning sign and should never be ignored. Multiple clinical resources identify reduced urination as a sign that sepsis may be affecting organ function. So let's quickly review the 10 warning signs. A feeling that something is seriously wrong, extreme pain, fever or feeling unusually cold, rapid heart rate, fast breathing, overwhelming fatigue, sudden confusion, skin changes, low blood pressure, and decreased urine output. If you notice several of these symptoms in yourself or someone you love, especially during an infection, do not wait to see if things improve tomorrow. Sepsis can progress rapidly. The CDC stresses that sepsis is a medical emergency and that fast action can save lives. Remember, many cases of sepsis begin with common infections such as pneumonia, urinary tract infections, skin infections, or abdominal infections. What appears harmless today can become life-threatening tomorrow. The key is recognizing the signs early and acting immediately. If this video helped you, Please subscribe to Healthy Wisdom for Seniors, give this video a thumbs up, and share it with a friend, spouse, caregiver, or family member. You never know whose life this information might save. And now I'd like to hear from you. Had you heard of these warning signs before today? Which symptoms surprised you the most? Leave a comment below. We read every comment and appreciate every member of our Healthy Wisdom for Seniors community. Thank you for watching, stay healthy, stay informed, and I'll see you in the next video.